This is the lesson to discuss the appropriateness and effectiveness of cognitive behavioural therapy as a treatment for schizophrenia. On this part of the course, you are required to discuss a range of different psychological and physiological treatments for schizophrenia. One of the named treatments on the specification is CBT. So, as with the biological approach, you need to understand the aims of CBT, how the CBT links to the assumptions, how useful it is, any research to support it. So, cognitive behavioural therapy you will have looked at in the first year when you looked at treatments of depression. Cognitive behavioural therapy is viewed as a cognitive therapy, although it is linked with behaviourism, and the aim of it is to challenge maladaptive thoughts and replace them with more healthy thoughts. Often the patient is encouraged to change these thoughts, challenge them, and replace them with more constructive, more logical thinking, and this will hopefully lead to healthy behaviours. Schizophrenic people are often unaware that they are subject to cognitive errors or that there are problems with their thinking. So CBT can be effective in helping people with schizophrenia to identify and recognise where they are making cognitive errors and to try to adapt and change them into more logical thoughts. So one of the first things that the therapist needs to do is to help the patient to identify the maladaptive thoughts, make them conscious, encourage the patient to challenge them, and to understand that there is no basis for these thoughts. So one example could be to challenge the voice in somebody's head and ask them for evidence that the voice exists and to challenge this evidence and to hopefully get the patient to see that there is no basis for these faulty thoughts. Here is the CBT model that you should have looked at in the first year, and as you can see, it is a cyclical model. And it starts off with the idea of it could start anywhere, but your thoughts and actions influence your life. The quality of your life then influences your mood and emotions, and then your mood and emotions influence your thoughts and actions. And that goes back to your thoughts influence your quality of life. So you could view it as being trapped in a circle of trapped thoughts. This is the basic CBT model that we're going to work on. For your AO1, make sure that you can describe how CBT actually works. So as we know already, CBT is drawn from the cognitive and behavioural fields of psychology. The cognitive element is thinking about the thoughts of the patient, thinking about how they view the world, how they think in their head and appraise situations, whereas the behavioural side comes about from looking at the actual patient's behaviour. So one of the ways that this works is by getting people to identify the thoughts and see how the thought actually changes or manipulates their behaviour. So one of the main ways that it works is getting the patient to identify their problem. Now, I'm hoping that already when you're watching this, you can see that we have a problem with this, because most schizophrenics have psychotic tendencies and will have lost contact with reality. So one of the main problems with this illness is that they won't know that they're hearing voices. They will believe that this is normal. They will also believe that their paranoid thinking is normal. They will believe that their delusions are normal and realistic. So this might take a long time to get somebody to actually start to recognise their thoughts. It might take years. Again, we need to consider when in the person's treatment it would be appropriate to do this. For For example, if a patient is in a severe psychotic episode, it would probably not be appropriate to ask them to challenge their thoughts. They wouldn't be able to do it. So you would choose during the episode a time when the episode had become less vivid, when they weren't hearing as many voices, and then they would be in a more relaxed and less anxious, less stressed way to be able to deal with it. So again, CBT does not work during an intense episode. The therapist aims to use a range of techniques in order to help the patient, and these are not prescriptive. There are lots of different techniques involved in CBT, and again, you can choose the ones that you think might be most appropriate. This one that I've chosen here is called reality testing, and this is one that I thought was very appropriate to schizophrenia, and it's where the patient is encouraged to actively find evidence to test the reality base of a belief or assumption. So for example, the therapist might ask if they can speak to the voice, and if they can see the person behind the voice, and could they have a conversation with the voice, and could they get answers from the voice. Now, this would be quite difficult to find the evidence to test this. Again, if people say there's someone watching me, you would be encouraged to get the patient to look for evidence for this, that somebody was actually watching them. And the hope is, and the belief is that in most cases the patient will not be able to do this. So there is an example here that you can read through yourself, which again is surrounding faulty thoughts. And this is just an example where the therapist can be quite clever in actually encouraging the patient to get evidence-based info and then challenging the info with facts. Okay, so one of the things that you need to look at now with this is to consider what are the main problems with CBT. So if we go back to this, you should be able to work out your own evaluation of this. So strengths include that it's based and rooted in cognitive and behavioural therapies and approaches. Therefore, it has a scientific basis. It's very effective in treating depression, and it's generally effective for schizophrenia, but not during a psychotic episode. There are, however, lots of weaknesses to using CBT. It cannot be used with the most psychotic of patients. They cannot understand it. They are not able to separate their thoughts from emotions from behaviours. As it states down here, CBT is working on looking at thoughts, behaviours and emotions. Someone who is schizophrenic in a psychotic episode would be unable to do this. Another problem is that it puts all the blame onto the patient. It implies that it is their faults that is causing their thoughts, that is causing the problem. And therefore, although they're encouraged to take responsibility, which could be seen as a strength, one of the weaknesses is that they do feel that it's completely their fault. And this might lead to them having problems in moving on with their illness. It also might cause them a lot of distress if they're being challenged about a voice that they believe exists and there is no reason for them to believe it doesn't exist. This might cause quite a lot of distress. CBT is found to generally be effective when combined with drugs. On its own, it's not the most effective treatment for schizophrenia. It's much better when combined with another treatment, and it must always be remembered that it cannot be used in a particularly bad psychotic episode. This ends the session on CBT.